Hello guys, welcome to my YouTube channel The Gem Pharmacy. Today 2 marks very important questions and answers of Pharmacology 2. First question, write a note on Iodosyncrasy. See, drug Iodosyncrasy, it refers to the untold reactions to drug that occur in a small fraction of patients and have no obvious relationship to dose. See, whatever the dose is, but for some patients what happens, there is a sudden reaction for that drug. This is known as the Iodosyncrasy. For an example, the drug is Dolo 650 or the diclofenac drug. For some patients what happens, there will be the occurrence of the hyper reaction of that drug. That is Iodosyncrasy. Side effects in simple example, barbiturates cause excitement and mental confusion in some individuals. Define bioavailability. Bioavailable means the drug availability. Here it is expressed as the fraction of administered drug that reaches to the systemic circulation. For an example, if 100 mg of the drug are administered orally and 70 mg of the drug are absorbed unchanged, that is known as a bioavailability, means 70% bioavailability. Significance of the therapeutic index, it is a range of doses at which the medication is effective. It is the range at which the medication or the drug is effective without unaccepted adverse effects. What is the range? The drug that is effective, that is known as therapeutic index. Larger the therapeutic index, safer the dose. Therapeutic index should be greater than 1. If the therapeutic index is less than 1, then the drug is unable to dispense in the market. Then what is a dose response relationship? The pharmacological effect of the drug dependent on its concentration at the site of action, which in turn is determined by the dose of the drug administered, is a dose response relationship. Next one is a classify parasympatomimetic. These are the drugs which activate the parasympathetic nervous system by mimicking the effects of the acetylcholine. That's called the parasympatomimetic, just opposite to the sympathomimetic agent. These are anticholinergic agents. Direct acting parasympatomimetic, that is muscarinic receptors. Indirect acting acetylcholinesterase inhibitors. What are the drugs used in glaucoma? Beta adrenergic blockers, timolol or levobunolol. Alpha adrenergic blockers like brimonidine. Carbonic anhydrase inhibitors, dorzolamide. It is used in the glaucoma condition. Drugs used in the pre-anesthetic agents. Some of the anti-anxiety drugs. Diazepam we are using in pre-anesthesia. Sedatives we are using. Opioid analgesic like morphine, fentanyl we are using. What is the mechanism of action of disulfiram? See, produces sensitivity to ethanol by blocking its oxidation. What it will do? Disulfiram, what it is? It is alcohol inhibiting or withdrawal, alcohol usage, consumption of the alcohol. It will cancels or it will stop the consumption of the alcohol. It is disulfiram. What it will do? It will produce the sensitivity to ethanol. How it will produce? By blocking its oxidation. Means alcohol will oxidize and form acetaldehyde. So this it won't allows. This which one? Disulfiram won't allows to form alcohol to acetaldehyde by oxidation and result in unpleasant reaction including palpitation, hypotension, nausea, this type. Because if the drug can't change to the acetaldehyde, then inside the stomach that alcohol or ethanol, what it will do? It cause the vision problem or blurry vision, and also it causes the vomiting sensation, vertigo, headache, these all. Diarrhea. Drug addiction, it is a physiological state of neuroadaptation resulting from a repeated administration of the drug. It is a physiological neuroadaptation where the repeated administration of the drug necessitating its continued use to prevent the appearance of the distress without symptom, alcohol or cocaine. These all are the drug addiction. The patient get addicted by the drug. He wants the drug. Don't you drug though. He wants the drug because of this drug addiction. Define, classify opioid analgesic with example: natural opium alkaloids, morphine, codeine, semi-synthetic heroin. Then polycodeine, synthetic. Natural means they are completely made from human. Mepridine, fentanyl, tramadol, methadone, etc. What are the different stages of signal transduction mechanism? Extracellular signal transduction, intercellular, intracellular. What do you mean by drug receptor interaction? It is a process of binding a drug to the receptor and exerts the pharmacological effect. It's called a drug receptor interaction. Types: cell membrane, emballed protein receptor, ligand gated ion channel receptor, G protein couple receptor, transcription receptor. What are the combined effects of the drug? When we use two drugs in combination, then two type of the effects will be there. Okay, two types of effects: synergism, antagonism. Syner, what is the syner? Addition, when the action of the drug is increased by the other drug. Anta, opposite, when the action of the drug is decreased by the other drug. Enlist the neurotransmitter in central nervous system. Excitatory, the best example is aspartate, adrenaline, acetylcholine. Inhibitory, GABA. Okay, 40% in our brain, 40% GABA neurotransmitters are there. Glycine, serotonin, these are all inhibitor. Acetylcholine, dopamine, norepinephrine, these act as a both excitatory and inhibitory. What are the adverse reaction of barbiturates? See, allergic skin lesions, then arthritic pain, drowsiness, hangover. These all are the barbiturates adverse effect. Barbiturates, hypnotic. Then classify muscle relaxant, diazepam. Which first one is a centrally acting muscle relaxant, diazepam, gabapentin, baclofen. Central acting. Peripheral acting, succinylcholine, peripheral acting. And sometimes this question may be asked in 5 mark. Write a note on pharmacology of the peripheral acting muscle relaxant. You have to write that succinylcholine. Sometimes you will ask central acting muscle relaxant, diazepam. What are the withdrawal symptoms of antidepressant? Nausea, anoxia, diphorosis, irritability. Write merits and demerits of rectal route. Avoid first pass metabolism, doesn't cause nausea, vomiting. The rectal route is safe and convenient for elder and young patients and also children. Demerits: inconvenient, absorption is slow, then erratic, and irritation or inflammation of the rectal mucosa can occur. What are the pharmacodynamic drug interaction? See, these are the interaction in which the activity of the drug, activity of the object drug and its site of action is altered by the precipitant. Precipitant means drug. Acetylcholine and noradrenaline have opposing effects. That's called pharmacodynamic. What is the pharmacovigilance? Very important. The practice of monitoring the effects of the medical drugs after they have been licensed. Pharmacovigilance means just checking. What we are doing? Checking, testing, practicing, or monitoring the effects of the drug after they have been licensed for use, especially in order to identify, evaluate previously unreported adverse effects. Okay, then example for short acting barbiturates: methoxyethyl sodium, then thiopentanol. Enlist the used in the Parkinson disease: levodopa, carbidopa, selegiline, then amantadine, rotigotine. Drugs used in Alzheimer's disease: donepezil, carbazepine, chlorpromazine, rivastigmine. These all are. Write the uses of the sympatholytic: hypertension, you can use conjunctive heart failure, glaucoma, or COPD. Okay, COPD, pulmonary disorders. Then imipramine as an antidepressant drug. It is a tricyclic antidepressant drug. It inhibits the reuptake of the serotonin. Okay, serotonin, norepinephrine, thus maintaining the levels of these in neurotransmitter. If these neurotransmitters are present in a large amount, means these are only known as happy hormones. They are present means no depression. If they are starts their breakdown with the help of the ammonia, with the help of the amines, what we call that monoamine, that monoamines, monooxygenase amines, what they will do, they will start the breakdown of these happy hormones. That leads to the reduction, degradation. So for that reason, these some of the tricyclic depressant we are using. So subscribe our channel, Let's Jump Pharmacy. Thank you.